The message: we must do more to help our children and keep them safe. A troubling new report finding that the COVID-19 pandemic has worsened threats to childhood, including mental health, abuse, and poverty. For more on this report, I'm joined by Kelsey Beson, Manager of Operations for Children First Canada. Good morning to you, Kelsey.
Good morning, Melanie. Thanks for having me.
Thanks for joining us. Definitely some troubling findings here from this report. And I want to begin with mental health. We've heard about it in adults during this pandemic, but it's having a major impact on kids. What have you found?
Absolutely. So 57% of young people between the ages of 15 and 17 years of age are telling us that their mental health is impacted negatively since physical distancing has been put in place. We're also finding that right now the leading cause of death for children between the ages of 10 and 14 is suicide, which is an incredibly disturbing fact.
So we were seeing from the report, too, that resources like Kids Help Phone, seeing an uptick in calls, kids looking for resources. How do they get through all of this?
Yeah, so Kids Help Phone has seen an increase in calls specifically around abuse, and the World Health Organization is saying that child abuse is probably the silent crisis of COVID. And how children are getting through that is very disturbing because they don't have access to safe and caring adults like teachers or coaches or other people that typically they would go to for safety.
And on top of that, I mean, if they're not willing to speak themselves, someone like a teacher, as you mentioned, maybe notices something, and because they haven't been in school, they don't have that adult figure. So that's definitely disturbing here. I want to talk a little bit about poverty and food insecurity. We know, obviously, kids who have been out of school, there have been a number of breakfast programs and whatnot that haven't been happening. So what have you been seeing in your report?
I mean, you hit the nail on the head, which is that a lot of young people who are experiencing food insecurity are families who have access to food programs through schools. With schools being shut down, food insecurity is definitely on the rise. About 15% of households have told us that in the last 30 days, they've had food insecurity. In addition to that, about 30% of Canadians are telling us that COVID has either had a moderate or major impact on their ability to meet their financial obligations and provide essentials like food for their family.
Yeah, no doubt, Kelsey. This has been a really difficult time for so many people. You did also look in your report about different marginalized communities and how it's specifically impacting them as well.
That's right. So one of the things to note first is that there's actually limited data around race-based data. And that's something that and many researchers are really encouraging, that we collect more race-based data to understand health inequities as they stand. But what we are clear on, the research tells us, but anybody who is a racialized person also tells us this, that there are disproportionate health outcomes for folks who are racialized. In particular, Black children, Métis, Inuit, First Nation children are more likely to have adverse childhood experiences like poverty and abuse be part of their life, as well as be overrepresented in the child welfare system and justice systems. And we're very clear that this is a symptom of systemic racism, which is why systemic racism is one of the top 10 threats of our report.
As we look ahead here, Kelsey, we are 2 weeks away from school, depending on which board you're at and depending on the province or territory you're in. Do you see a reversal in some of this, or do you think that many of these trends will continue?
It's hard to know for sure, but what we suspect is that COVID is going to continue to adversely affect childhood. And part of that is because we don't have a national strategy around children to address these top 10 threats. These top 10 threats have been consistent. Canada's actually fallen in terms of how we do with children's health in the last 10 years. We were 12th out of 41 similar countries. Now we're 25th out of 41 similar countries. So with COVID, the concern is that likely children's health is going to continue to be negatively impacted, and all of these top 10 threats that have been consistent are going to be amplified.
Oh, wow. A lot to follow here. Kelsey, we appreciate your time this morning. Thank you so much for joining us today.
Thanks for having me.
Your time right now is